Hi everyone, welcome back to my YouTube channel, and today we are going to talk about sublingual gland anatomy. So let's start our topic with introduction. Sublingual gland is the smallest of three major paired salivary gland. It is a mixed gland, but its secretion is predominantly mucus secretion. This gland is located beneath the mucosa of the floor of the mouth. It is in close relation to the tongue and plays an important role in maintaining oral moisture and lubrication. Location of sublingual gland. It is situated in the floor of mouth, beneath the oral mucosa and superior to the mylohyoid muscle. It lies in the sublingual fossa of the mandible. It is positioned anterior to submandibular gland and it is present lateral to the tongue. Talking about shape and size of sublingual gland, it is almond shaped and it is about 3 to 5 gram in weight. As you can see in the diagram, the sublingual gland below the tongue and it is above the mylohyoid muscle. It is flattened and elongated structure. Talking about the capsule of sublingual gland, it is enclosed in thin fibrous capsule. It is covered by oral mucosa rather than deep fascia that make it more superficial than other major salivary gland. Talking about relations of sublingual salivary gland, it is superior to sublingual salivary gland is oral mucosa of the floor of the mouth. Inferior to sublingual salivary gland is mylohyoid muscle. Medial to sublingual salivary gland is genioglossus muscle, and lateral to it is sublingual fossa of mandible. And posterior to it is deep part of submandibular gland. Talking about ducts of sublingual gland, the gland has numerous ducts that include major sublingual duct that is also called as Bartholin duct that join the submandibular duct and opens at the sublingual papilla near the lingual frenulum. And it has minor sublingual ducts that are also called as Rivinus ducts that are about 8 to 20 small ducts that open separately along the sublingual floor on the floor of the mouth. Now let's talk about microscopic structure of sublingual gland. Predominantly, this gland has mucus acini with some serous ganglions. They produce thick mucus-rich saliva that lubricates the oral cavity. Talking about nerve supply of sublingual gland, it has parasympathetic nerve supply that is the secretomotor nerve supply. It is from facial nerve to chora tympani and submandibular ganglion. And then it has sympathetic nerve supply that is from superior cervical ganglion, and this nerve supply causes vasoconstriction. And then it has sensory nerve supply that is carried by lingual nerve, that is the branch of mandibular nerve. Talking about blood supply of sublingual gland, blood supply include arterial supply and venous drainage. Arterial supply of sublingual gland is by sublingual artery, that is the branch of lingual artery, and by submental artery, that is branch of facial artery. And venous drainage of sublingual gland is by the this venous drainage corresponds to arterial supply, and this venous drainage ultimately drain into the internal jugular vein. So as they correspond to the arterial supply, so it has sublingual vein and submental vein. Lymphatic drainage of sublingual gland. The sublingual gland primarily drain into submandibular and submental lymph nodes that then lead to the deep cervical lymph nodes. Functions of sublingual gland. First, it secretes mucus-rich saliva for the lubrication of oral cavity and for the facilitation of speech, swallowing, and mastication. And it also the secretion of this saliva and this mucus saliva also help in the maintenance of oral pH and the protection of teeth. Clinical significance of sublingual gland. First, there may be ranula, that is the cystic swelling that is caused by obstruction of sublingual ducts that appear as a bluish swelling in the floor of the mouth. Second significance is silolithiasis, that is also called a salivary stone, that is less common in case of sublingual gland and it is more common in the submandibular gland, but it is also possible in the sublingual gland. Third significance of the sublingual salivary gland is tumors, That is rare, but they are usually malignant when they are present. Fourth, significance is surgical note, as care is needed due to close relation to lingual nerve and Wharton's duct, and care is needed so these structures are not damaged in case of surgery. Conclusion of this lecture video. Sublingual gland, though the smallest major salivary gland, plays a key role in maintaining oral lubrication and protecting oral tissue. Its superficial position, multiple ducts, and close relation to important structure to the floor of mouth make its anatomy clinically significant for dentists, oral surgeons, and ENT specialists. And this was all about sublingual gland anatomy. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.